In 2018, Healthy0360 was proud to be a partner of All.Can's patient survey. The purpose of this survey was to explore the cancer patient perspective on inefficiencies experienced during diagnosis, treatment, and aftercare. This was a survey unlike any other, taking place across the world and entirely from the patient perspective. Healthy0360 is proud to have partnered with All.Can for the United States portion of this patient survey. And here are some of the results.
In 2018, 1,735,350 new cases of cancer were diagnosed in the United States alone. Of the sample who participated in the survey, 25% had breast cancer, 11% had gynecological cancer, 11% head and neck, and many more. 87% of those cancer patients were between 25 and 64 years of age. A total of 497 people were surveyed in the United States. Diagnosis was one of the main areas where respondents reported the greatest inefficiency. 31% of those not diagnosed via screening were diagnosed with something different, and 12% waited more than 6 months to be diagnosed with cancer. For many cancers, early diagnosis can improve survival and is also associated with reduced treatment costs. Late diagnosis and misdiagnosis can lead to delays in treatment or limited treatment options, poorer outcomes, lower likelihood of survival, and higher costs of care. After diagnosis, 41% of patients did not feel sufficiently involved in the decision-making process for their own treatment, and 25% did not receive an adequate amount of comprehensible information regarding their cancer care and treatment. Shared decision-making is associated with improved patient outcomes. Information can help people feel in control of their disease, reduce anxiety, create realistic expectations, and promote self-care and engagement in their care. Fulfilling patients' needs for information is also associated with improved treatment adherence and better clinical outcomes. During treatment and beyond, 31% of patients felt a lack of support for dealing with the symptoms and side effects even beyond the active phase of treatment. 30% were not given enough information or could not understand the information they were given about signs and symptoms that could indicate their cancer was returning or getting worse. In the US, nearly a quarter of the patients who responded to the All.Can survey did not receive information about resources for support, such as patient groups, charities, etc., during treatment and afterwards. Without appropriate follow-up after discharge, patients can feel lost or abandoned and ill-prepared to manage their condition after weeks of intensive treatment and frequent interactions with their care team. "59% of patients felt the need for psychological support during or after their cancer care, but of those, 31% said that support was not made available to them. According to the International Psycho-Oncology Society, IPOS, 40 to 60% of cancer patients and family members experience psychological distress that could benefit from intervention, but only a minority receive psychological support and care. Patients with depression have a 39% higher risk of mortality and higher healthcare expenditure than patients who do not have depression. The majority of patients had to pay for at least some part of their cancer care, either through out-of-pocket expenses or private insurance. 31% reported loss of employment and 10% reported loss of insurance. Travel costs were reported by 44% of respondents. There is growing evidence from different countries that many patients face a cascade of financial burden due to cancer. People surviving cancer are 1.4 times more likely to be unemployed and 3 times more likely to receive disability benefits than the general population.
These All.Can patient survey findings reiterate that the impact of cancer stretches far beyond the physical. It impacts careers, income, and even relationships. The information patients need in order to cope with cancer is often presented in terms they simply cannot understand. Presenting this information, though, is not enough. Patients must comprehend it in order to apply it to their own personal treatment. At least 20% of total healthcare spending is estimated to be wasted on inefficient care. So I challenge you to begin asking the tough questions. How can we give patients the care they deserve? How can we ensure that their today is as positive as it can be? And how can we ensure a promise of tomorrow?